And what I talked about last week was how what the difference is between normal use, to be habituated and to be addicted to a medication. And my view of it is that it is a continuum or spectrum, where you start on the one side with use of a medication intermittent and which is helpful. So I used as an example a headache. I have a headache, which I don't get that often, but I get a headache, and I look around, I find some painkiller, I take one or two, my headache goes, and I think, great, and I just get on with my life. When I have a headache again a few months later, I think, oh, I remember that stuff that worked. So I have a conceived idea, and I know that it worked before, which is now strengthening its power, but it just helps me so that I can get on with my life, and I don't think about it again until the need arises. And this is wonderful use of medication. It's a help. It's a help to make life better and to reduce your suffering, and has no hold over you at all. So that's the one side, the best use of medication. In the middle is habituation, which is where you start using the medication more and more, and then you start using it regularly. There's no escalation of dose. You find a dose and you find that it really works for you. And then you have a little thought worm which says, oh, this stuff is really making me feel better. And I am nervous / frightened of coming off it, because then I will have more pain or more whatever the other symptoms are. And so what you have created, and it is actually of your own creation, you have created a psychological dependence on the medication itself. That psychological dependence can be very small, so it's not really a big deal, but it's there a bit, or it can be quite huge. And so that's part of that gradation, that continuum. And then right on the other end is addiction, where there is not only a psychological, but there is a physical addiction. And the definition I found, which I liked, of addiction is that your neurons, in other words, the nerves in your mind and your spinal cord and in your body, have become adapted through a neuroplastic process. They become adapted so that they can only function normally, and normally is inverted commas, while you have the drug on board or the substance on board. And therefore, what happens is you take the drug and then you are okay. And then when the drug level drops, your mood plummets. And as your mood plummets, if you're using it for pain, your pain explodes, your mood drops, and you turn on a craving. So now you crave for the medication. Not only do you turn on a craving, which is an emotional construct, it's something that you suddenly feel you need it, but you also turn on a whole lot of physical fight and flight symptoms, which exacerbate the whole thing. And so you become incredibly anxious, you become shaky because you're making a lot of adrenaline, and your stress substances, and then your blood pressure goes up, your heart rate starts to get worse, you're sweaty, you may get diarrhea, vomiting, and feel incredibly unwell, such that some high-functioning people can be addicted and keep their job and keep everything going, but it's pretty hard. But for a lot of people, there's a downward spiral such that their relationships break down, they lose their job, they can't get money, they may even turn to crime to keep the substance, keep getting to the substance. And they deteriorate or disintegrate physically, mentally, emotionally, and in every way. So that's addiction. So the important thing is that there are certain medications that will create, because they work so well, quite a strong psychological dependence, and we talked about pregabalin, Lyrica, and gabapentin, amitriptyline, and so on. These duloxetine, these are the substances in pain which we know do make a real difference because they quieten nerves down. And then the substances that create abuse are opioids, every single one of them. Tramadol, which is kind of an opioid but is all mixed up. All the benzodiazepines, and then the two biggies, alcohol and nicotine and tobacco and cigarettes. So and of course there's a whole group of other addictive substances. So the important thing is to see where you are on this continuum. Excuse me, I'll just have a sip here. And to recognize that the vast majority of people are not addicted, but have a psychological dependence to a greater or lesser extent. If you have a psychological dependence, if the stuff's working and you have minimal side effects, who cares? It's just part of your toolkit. If it has significant side effects, then you're in this kind of difficult state where you have to kind of wean it down to find the sweet spot where you're getting benefit. Any problems that you have are much less than the benefit. And then as long as there are no significant long-term side effects, and in fact, interestingly, with all the anti-neuropathic medications, the gabapentin, pregabalin, amitriptyline, nortriptyline, duloxetine, there are not a lot of really significant long-term, it doesn't rot your liver or rot your brain or do awful things. The symptoms usually are just related to quietening down. So you may feel heady, you may feel dizzy, you may feel not able to concentrate. And once you habituate to it, often you find that in fact the benefits are much greater than the others. And if it's working, stick with it. So that's my just reviewing of last week. So at this point,